This video is made possible by our loyal Patreon supporters. Visit patreon.com/psychetruth.
Hello, thank you for joining us today. Our model today is Julia, and we're going to be doing a neck and upper back massage, and I'm going to go ahead and get started. So, a few things to kind of notice about the way that I'm getting started. I'm going to go ahead and talk as I do some compressions to warm up. Whenever I'm working on someone face down and I'm doing neck work, I always make sure that the neck is at a downward facing angle. So always making sure that the face cradle is pointed down slightly. Otherwise, there's just not enough tautness in these neck muscles to really get very much done. So just keeping that in mind, and this is usually the way that I will approach neck work if someone has limited mobility and it hurts for them to turn their head, or if they're just in a lot of pain but they want neck work. And this is just a way for me to kind of connect with my client and help her to get familiar with my touch if this is the first time I'm working on them. I've worked on Julia several times, and I'm starting to work my way around the scapula. So just using the heel of my hand. And I'm going to go ahead and just do stacked hands, and I'm going to start working my way around, just feeling for any potential trigger points. So I'm doing kind of a mental scan of areas that are tight and working the soft tissue. And I usually do some sort of dry work before I go in with oil. Making sure that there's plenty of oil on the neck so they don't have to keep going back and forth. And this is also a really great place to see how your flow is if you are starting to work your way into the neck and it feels kind of choppy. You might need to adjust the face cradle. You should be able to just kind of float your hands all the way up in a pretty smooth way. And I'm also just scanning Julia's neck from right to left. And sometimes I like to just do a little bit of arm work. I just don't like it when things start to feel too localized. I like my client to feel really connected to a broader space. And starting to focus in more on this upper trap. Paired thumbs is a really nice way to approach the upper traps, especially if you're planning on not using your elbows. And just being mindful of how I begin and end. So just being fluid in how I transition. And right now I'm working a little bit more superficially, but I'm going to start to go in a little bit deeper here in a minute. Especially if someone's in pain, I am really slow to increase my pressure. And you might find that just with how the muscle's sitting, a different technique might feel a little more natural. So don't feel like you have to do the exact same thing on each side. And you can start to do a little bit of trigger point. Once everything feels like it's responding well, not fighting you. I typically prefer to do this kind of work with my forearm and my elbow, but sometimes it's fun to use the thumbs. And if you feel like you want a little more tautness, this is definitely a really good arm position for working on the upper traps, but I feel like I want a little bit more tautness. So I'll just kind of pull that elbow out a little bit, making sure that her elbow is supported. And you can approach this muscle fiber from different angles, depending on the trigger points that you found. I like to do a nice broad stroke on both sides whenever I do that kind of work. And I'm going to go ahead and work my way into the levator. This is also a really nice angle to work on the upper traps. So get a nice firm hold there. Just whenever I do trigger point of any kind, I don't like to just leave it because it feels just kind of want to do something that's a little more calming after anything like that. And just starting to gradually work my way in a little bit deeper. And at this point, I do need to just check in with my thumbs and make sure that I feel good. If I'm feeling pain in my thumb joints, I want to consider a different technique. So working on the neck in this way is kind of nice because the neck's really stable, and it's in just one position. You also have the upper traps totally exposed, so it's a great place if you want to work all the way into the neck and you're more focused on the trap, upper trap. It can be fun to explore different pace. You can walk out your hands, so you can do them at the same time. And I'm gonna start working my way into that, bringing that nice firm pressure along the upper trap all the way into the neck. You can do broader circles. And working my way down. I don't really this isn't my favorite way to work on the SEM. I prefer it when my clients face up, but sometimes that's not always an option. And if there's a lot of sensitivity or if there's swelling in the scalenes or the SEM, I'll actually use the whole surface area of my thumb and do a nice broad stroke. This is a great place for trigger points if you feel like that's necessary. And you might want to change position of the arm a little bit. And even when I do trigger point, continue that stroke all the way up. And if you're finding that the muscles are resisting your touch, you might need to decrease the amount of pressure you're using. I would definitely communicate with your client, see how things are feeling. And I do really enjoy doing work along the occipital ridge because the head's stable, the neck's stable, and I feel like my client can really let go into this maybe a little bit more. Again, just make sure that you're paying attention to cues from your client, just to make sure that you're not going too deep. or maybe you need to go more deep. Just depends. I like to just do something really soothing on that mastoid process. Just kind of checking in. And I'm going to go ahead and start with this opposite side. And you might find that as you move from the upper trap into the SCM and the scalenes, you might want to change position of the arm. But I really like this position of the arm for the upper trap. And if you're finding a little more swelling in this area, you might want to consider just doing nice broad circles, just flushing everything out. That is if it's not, if it's just acute swelling. If it's severe swelling, you don't really want to work on that area. But sometimes if there's any, moderate swelling, you don't really want to do super deep work. Just kind of depends. And as you start to move away from that upper trap, can be feel kind of a better flow with the muscles. Move the arm. And I'll usually make a few passes over the SCM and the scalenes before I decide if I'm going to do trigger point or not. And if you do trigger point on one side, it doesn't mean that you have to do it on the other side. I have clients who love getting neck work done face down, and others who definitely prefer it when they're face up. Kind of fun to do both. And there's also people that just don't feel comfortable receiving massage face up. So it's nice to know that you have options for everybody. Another thing, if you feel like you're not getting the tautness that you want, you can use one hand to isolate. And so you can just create a little bit more traction in the muscle by using both hands if you're struggling with that at all. This is really great if you're wanting to lengthen the muscle you're working on. Just ending with a little bit of work along this occipital ridge. just checking in with that mastoid process. And just being mindful of tying it all together. I'd like to thank a few of our patrons. I'd like to thank Crit, Macaria Santos, and Anthony. Thank you guys so much for your support. And that is all for today. I hope that you enjoyed today's video. We enjoyed spending this time with you, and I look forward to seeing you next time.